Is that your sister? Oh my goodness. When ER doctor Elizabeth Claiborne's maternity leave was wrapping up and she prepared to return to work, protecting her family was at the top of her mind.
As a mother, you always are going to do your best to protect yourself and your children.
In the emergency room, on any given day, about a third of her patients she's treating have COVID. It's given this doctor reason to advocate for something many of us don't talk about: advanced care planning. It's simple in concept. What type of care would you want if you became too sick to tell the doctor yourself? Dr. Claiborne says, especially during COVID, anyone, even young people, can make an advanced care plan.
If you've not thought personally about what you would want done if you got into a medical emergency, I as a physician then have to call your family and ask, what's going on? What's the history of this person? What do you want me to do?
Research from the University of Pennsylvania showed the number of completed advanced care plans rose by about 5 times as much during the pandemic than before. Claiborne has one for herself and for her family members, she says, after seeing too many difficult and raw conversations from her patients.
The family member trying to make a decision might be under a lot of pressure and stress to talk or think about issues related to end-of-life care or medical admissions that they've never discussed before.
All right, small pinch. 1, 2, 3.
Now that she's back at work, Dr. Claiborne still thinks about protecting her family, getting her first dose of Pfizer's COVID vaccine this week.
I need some kind of extra layer of protection.
She adds, while it may seem grim talking about something like an advanced care plan, especially around the holidays, it's helpful to consider it.
Now is the time for you to talk to your family. Take this holiday time when you're Zooming or, video chatting with your loved ones to say, hey, what is our emergency plan? Who makes decisions for our loved ones? Where have we documented that?
Lindsay Thies, Newsy, Denver.